So my name is Sarah Schaolf. I am a fourth year medical student and master's in public health student at UConn. Sure. So what made me decide to pursue an MPH? I, as I mentioned, am in medical school. And I think as someone who's going to practice as a clinician, it's very important to have a thorough understanding of the healthcare system and the network that surrounds just what you might see in a hospital or a clinic. There are a lot of considerations that comes to insurance, that comes to what the local health department can do versus what a provider or a hospital can do, and having a more robust understanding of what that network looks like, as well as thinking about the role I can play in that system, really inspired me to reach for the extra degree. And I was lucky enough that UConn had a great opportunity to do so. Most simply, I saw an email saying they were looking for students to participate in this pipeline program through experiential learning at a local health department. And as soon as I saw the email, I thought, wow, what a great opportunity to really get your feet on the ground, to really dive right in to public health in its truest form at the local health level. I'm someone who definitely likes to get my hands dirty, so to speak, likes to learn by doing. So having the chance to participate in this grant was really an amazing opportunity to get to learn about local public health by actually being involved in it. So, my role at Eastshore District Health has been really multifaceted, and I've been very fortunate to get to work with a number of different departments. Right from the outset, I had the chance to sit down with Mike, the health director at Eastshore, and talk about what were my goals for this process and what did they hope to get out of it by having me as an intern. So, in doing so, I've had the opportunity to work with public health nursing on COVID vaccination clinics. Vaccine hesitancy is something I'm really passionate about. I've had the chance to work with Nurturing Families Network, which is their home visiting program, on a project that hopefully is going to actually continue over following the end of my internship on promoting safe sleep amongst their participants. I've had the opportunity to participate in tabletop exercises, to go out with the registered environmental health specialists and do assessments for lead in a building. So, really, kind of any facet that I wanted to explore of local public health, they gave me the opportunity to do so, which was awesome. So, challenges that I faced while being here. I was fortunate that overall it was really smooth sailing. The team at East Shore is so accommodating. They have been great to work with my schedule, my various needs with taking courses. Something I learned as I started working on this longer term project with Nurturing Families Network involving designing a research project is that research takes a long time. And I think anyone in public health or in the research field would kind of nod and smile and laugh at that. But, as a student, that's something that was a lesson I kind of had to come to. So just learning to be patient, learning to take things as they come, working in a sequential order, I think was how I learned to sort of overcome that challenge, and also not being afraid to ask for help, whether that's reaching out to a mentor at the department, reaching out to somebody at the UConn School of Public Health to ask for guidance. Making sure to rely on the network that you have is a great way to overcome any challenges that come your way.
My name is Michael Pascusilla, and I serve as the CEO for the Eastshore District Health Department and Director of Public Health. I can't even begin to tell you how this grant opportunity has enhanced our ability to improve the lives of our communities. For instance, we do a lot of research here at the Eastshore District Health Department on the coast of Connecticut, and we have students both in Connecticut and outside Connecticut. And we are able to take it to the next step. And so I really need to thank the Department of Public Health, specifically the Commissioner of Public Health, for this grant funding opportunity, and also our university partners. So we use students all year round. And so we have spring, fall, and summer interns from different universities, both here in Connecticut and outside of Connecticut. And we give our students a real life experience. And what this funding has done is it gives them the full breadth of what it is like to work in a local public health department. There are expenses that come with it. We expect our students to look professional. They use their own cars to get around. They're here all day and they need to buy lunch. And so what this does is it offsets their costs. As we know, the price of education is quite high. And so what this does is it helps offset their costs. Also, full circle, it gives them the ability to form a professional resume, real life experience. They work side by side with our community and our staff. And so, again, this funding has taken it to the next step, and I would encourage um, the state to support it as much as they can.
Being able to access the funding from this grant was so instrumental in being able to participate in this program. As I'm sure everybody knows, graduate school, med school, it's so expensive. And I live up in the Hartford area, so commuting down to Brantford, while certainly worthwhile, it's not trivial. Gas is pretty expensive. So being able to have my work supported by a stipend was really instrumental in feeling like I could then dedicate my time and attention to the work that I was doing here and not have to worry as much about the financial side of it.